Pioglatazone is an oral antidiabetic drug. It belongs to the class called thiazolidinediones. Currently, two members are available in this class, pioglatazone and rosiglitazone. However, we will be focusing our discussion on pioglatazone. So how does it act? It is a ligand of the nuclear receptor called peroxisome proliferator activator receptor gamma or PPAR gamma. It acts on this receptor mainly in liver, muscle and adipose tissue. So we have a look at the primary action. Pioglitazone acts on the PPAR gamma receptors in the nucleus. By acting on these receptors, it regulates the genes related to glucose and lipid metabolism, thereby resulting in an increased sensitivity towards insulin in liver, muscle and adipose tissue. This results in an increased insulin-mediated glucose uptake by around 30 to 50%. Therefore, it is also called as insulin sensitizer. Hence, it is obvious that pioglitazone requires the presence of insulin for its pharmacological actions and is therefore not indicated in type 1 diabetes mellitus where there is an insulin deficiency. Pioglitazone also activates PPAR alpha receptors and therefore some of its actions mimic with that of fibrate class of antilipidemic drugs. Fibrates, as we can recall, are also PPAR alpha activators. Hence, like fibrates, pioglitazone causes decreased triglycerides, increased HDL cholesterol and decreased plasma fatty acid levels. Let's have a look at the adverse effects. The most common adverse effects include fluid retention, edema and weight gain. Fluid retention and edema occurs in up to 10% of patients and can precipitate or worsen heart failure, which is a significant concern. Weight gain appears to occur due to the combined effect of fluid retention and increase in total fat mass. It can also cause macular edema, which occurs as a consequence of fluid retention, but it also improves when the drug is discontinued. The incidence of fluid retention, edema and weight gain is nearly doubled when pioglitazone is used along with insulin as compared to either drug used alone. However, the greatest concern is an increased incidence of congestive heart failure. This is generally attributed to the drug causing an increase in plasma volume in those type 2 diabetes patients who have a significantly increased risk of heart failure. Pioglitazone therefore should not be used in patients with NYHA stage 3 or stage 4 heart failure and must be discontinued in those who develop clinically apparent heart failure during therapy. Apart from this, an increased incidence of bone fractures in females has been reported. This is probably due to decreased osteoblast formation. Coming to the indications of pioglitazone, it is used mainly in the treatment of type 2 diabetes mellitus. How is it used in these patients? It may be given as monotherapy or it may be given as a combination therapy with some of the other drugs used in type 2 diabetes mellitus, such as it can be used in combination with metformin, sulfonylureas and insulin. It should be borne in mind that the onset of action of pioglitazone is relatively slow and the maximal effects gradually develop over a period of 1 to 3 months. Thanks for watching. If you find the information in this video beneficial, do like, share and subscribe this video.